Is obesity a mental or physical problem? What do you need to know about COVID and obesity? Hi there. Thank you for tuning in and for sending your questions. I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. Our topic today will help you recognize obesity factors related to mental health and physical problems and how they relate to COVID. I will also give you an update on the Omicron BA1 and BA2 and some good news about new vaccines and treatment for COVID 19. Is obesity due to mental health issues, or a person with mental health issues has a tendency to obesity? What about physical issues? Are they all related? First of all, if you are dealing with obesity or mental health issues, I'm here to tell you it's not your fault. This is a complex challenge, so don't blame yourself. It's not your fault. The National Institute of Health presented studies linking obesity with depression, but also other psychological issues play a part in both. Obesity increases the risk for several physical issues: heart disease, diabetes, strokes, high blood pressure, high cholesterol, sleep apnea, even gallbladder disease, arthritis, and several types of cancers. Excess body fat also increases body inflammation, which weakens the immune system. This is a serious chronic disease. But the good news is that obesity can be treated. The best approaches to treat obesity are the ones personalized. Each person is unique in their physical and mental abilities. Genetics and environmental factors play a role in both. For instance, some genes are linked to cortisol response to stress, which is good in case of a real danger. However, the chronic stress and overproduction of cortisol has metabolic effects on mental illness and tendency to obesity. Although the mechanism how this happens is not well understood yet, studies have shown that persistently elevated cortisol can make cells resistant and decrease its ability to control inflammation. Environmental factors has to do with exposure to people and places that promote a healthy lifestyle. So if you have friends who are always active and encourage you to go out in nature, and they have habits of eating healthy foods, most likely you make better choices. Another factor is where you live. If you feel safe walking to do errands, or some cities are designated to promote activities and be easier to just walk around. One of our questions today is better to treat depression first or obesity? This is a very good question, and I have heard this question several times in my office. Each person is unique and depends on several factors to decide which condition is more severe and acute. It's important to consult with your doctor and design a treatment plan together. Usually, they can both be treated at the same time, but the attention may shift from obesity to depression and vice versa, depending on the situation at that time. It's difficult to establish which one causes the other, but research has shown that obesity and mental health are often found together, and it's necessary to treat both for a better result. Another question that came in is, can you give example of mental problems that affect obesity? Okay, here we go, a few examples. Chronic stress may make you use food as a way to cope, usually making poor choices of food. So, stress and food choices. Another one is depression and anxiety are linked to low serotonin levels, which can cause sleep problems and carbohydrate cravings. There we go. Another one is depression usually comes together with lack of energy. So your motivation to be active and exercise may be low or even not even there. Another question that came in, very interesting. What can I do to help my husband to lose weight? First of all, nobody can make anybody else to lose weight. Sometimes helping doesn't help. Have compassion and don't judge him. Usually, people struggle with weight for many years or even a lifetime, and it's not a lack of willpower or self control. Some people may think that weight discrimination or fat shaming would motivate an individual to lose weight. It's actually the opposite. This behavior triggers stress, diminishes the person's self-esteem, and often leads to overeating. So it doesn't work. Another one, the best support family and friends can give to someone they love who is overweight is to model healthy lifestyle. Take care of yourself. People don't change by feeling bad, they change by feeling good. Several studies with tens of thousands of people all over the world agree in one key point. The most effective approach to weight loss is to stop focusing on weight loss and change the focus to improving overall health. Another question came in. How do I know I need to seek professional help for my anxiety and overweight? Number one, if you have tried strategies by yourself and they have not worked long term, it's time to seek professional help. You don't have to deal with this situation alone. Make an appointment to see your primary doctor and discuss the situation. If you don't have one, I'm here for you. Obesity and mental health issues are complex, but they can be treated. I have treated several patients who have achieved their goal by doing small and easy habits change. They can be powerful when done consistently. Sometimes just maintaining the weight, not gaining weight, is already a good start. Then losing little by little. Whatever approach you may use, it has to be simple and easy to be sustainable in a long run. Now, let's talk about obesity during the pandemic. A Harvard study done in 2021, last year, showed that 42% of Americans gained an average of 29 pounds during the pandemic. Some reasons were related to stress, job loss, and sedentary lifestyle. The pandemic also worsened the social and economic disparity, and many families cannot afford to buy healthier foods. It's well established that obesity increases the risk of hospitalization and death from COVID-19. So it's a reality. Mental health issues increased during the pandemic as well. And Dr. Paulini, our guest last week, talked about this quite well. If you didn't have a chance to attend the live, last week, it's in our YouTube channel, so you can just go ahead and check it out. It was really good. Studies have shown a significant increase in the number of US adults with symptoms of stress, anxiety, depression, insomnia during the pandemic. Take care of your body and mind and connect with others. Seek professional help if necessary. Now, some updates about Omicron. So Omicron is trending down in most states in the US, good news, including Florida, and it's across all age groups. Still good. You may have heard about the BA1 and BA2, and some people have asked me if these are new variants. Actually, BA1 and BA2 are subsets of Omicron, not another variant. BA2 is more contagious than BA1, but less severe, and BA1 was already mild. Now, interesting is that the vaccine and natural immunity have shown more protection against BA2. If you had BA1, most likely you will not get BA2, but we don't know how long the antibodies will remain strong. So just, keep your precautions. Here are a few numbers showing vaccine effectiveness to symptomatic disease. Just keep in mind that we still have a small number of BA2 to draw final conclusions, but it's interesting to see. With 2 doses of vaccine, you have 9% protection against BA1. With 3 doses, of vaccine, you have 63% protection against BA1. Now BA2, with 2 doses of the vaccine, you have 13% of protection against BA2, and with 3 doses, the booster, you have 70% protection against BA2. So the protection against symptomatic disease is quite good, up to 70%, but the protection against hospitalization is even higher. So those are good news. So get your booster. If you have 5 months from your second dose, go ahead and get your booster. Some more good news. Moderna got full approval from FDA on Monday, January 31st, 2022. And the commercial name of the vaccine is Spikevax, all the fancy names. Pfizer, as you may know, already got full approval last August 2021. And the commercial name for the vaccine is Comirnaty, all the names, right? So Pfizer is approved for 5 years and up. My granddaughter, who is 5 years old, got her 2 doses already. And she did great, no side effects. She's doing great. Pfizer has studies on the way for 6 months and up. And the booster is recommended for 12 years and up. So those are information that we have so far. Another good news is another vaccine that is on review for FDA approval. It's called Novavax. This vaccine uses a more conventional approach using tiny particles of the viral protein. So people who are hesitant to be inoculated with RNA technology may have another choice. So Novavax vaccine is giving as 2 shots, spaced in 3 weeks apart. And Novavax has been already used in India, Indonesia, Netherlands since November last year. So it has received authorization from WHO and other health organizations in Europe. I also received questions about why FDA banned monoclonal treatment. The short answer is that this treatment is not effective against Omicron. And 99.9% of the cases we are dealing with now is Omicron. So it didn't make sense to expose people to possible side effects of the treatment without the benefit. So at this time, we have options for oral treatment for COVID, and the Paxlovid and Monopiravir, which are available, limited supplies too, and they require a medical prescription. But it's out there. If you have COVID symptoms and you are in Florida, I can treat you via telemedicine to get you back on your feet as soon as possible. Please subscribe to my YouTube channel, like the videos, and share with your friends. See you next Tuesday for our live Q&A. Keep moving towards your best self. Be healthy and feel well.